Sacred Heart Medical Center and Oregon Health and Science University co-developed Oregon's first telepediatric consultation service in 2006. Since then, OHSU pediatric intensivists have consulted on over 100 children at Sacred Heart Medical Center. Approximately one-third of these children and their families were able to be cared for without being transferred to Portland. In the following scenario, a pediatric hospitalist in the adolescent and pediatric unit at Sacred Heart Medical Center at RiverBend sees that his patient is worsening. He decides to consult with a specialist at the pediatric intensive care unit at Dornbecker Children's Hospital in Portland.
Yeah, I think I want Dr. Ross to take a look at her, because even after the treatment, she's still really not moving good air. Let me go grab him. Hey, Dr. Bressa.
Okay, one more time, okay? Okay, good job. How long have we had her on the continuous nebulizer? 3 hours, you think?
Yeah, probably about 3 hours.
Okay. Well, I think she's kind of getting a little bit sicker, so what I'd like to do is contact the intensive care doctor, the pediatric intensive care doctor up in Portland at OHSU, and see if they have any other suggestions as far as care for her. Okay? Isa, this is my friend Dr. Ellen B. He's a doctor up in Portland, and he's a doctor who's going to help us to find some medicine to help you feel better. Okay. Mom, this is Dr. Ellen B. Miles,
morning.
This is Isa. She's a 7-year-old girl who came in about 3 or 4 hours ago from the emergency department in RiverBend, and she's a known asthmatic. And she was, when she came in, we gave her steroid bolus. We've had her on continuous albuterol nebs for probably about 3 hours. Probably about a half hour ago, her oxygen needs really increased. She's currently on 10 liters on a non-rebreather. Her gases look okay, her pH is fine, her PCO2 is probably about mid-30s. The question I have is further management, and I was thinking about doing mag sulfate, but you have any thoughts on her?
Yeah, a couple quick things. Did she get an IV bolus of steroid?
She did, yes. Yes.
And 2 per kilo Telemedicine+Sacred, or?
Yes, exactly. Yep.
Great, okay, good. And have you seen any change, better or worse?
She got a little bit worse about an hour ago, and that's why I did her chest x-ray, which to me looks fine. I was worried that she got a pneumothorax, but she does not. She's clearly hyperexpanded on that, as you would expect. She's had an antecedent URI. She normally takes Flovent at home. She hasn't been quite so good with that over the last week, but.
Okay. Okay. Well, if you can have them push the X-ray up, that's always nice. I can take another look at it. But yeah, mag would be fine. We usually give 25 to 50 per kilo. Milligrams per kilo is a bolus. The only thing you really need to watch for is hypotension. It looks like her pressure's fine right now. Isa, can you say hello to me? Okay. Can you do me a favor? Can you count up to 10 as fast as you can? Okay. Good job. Okay. Yeah, so the next thing we would do would be mag, and if you reach the 6-hour point, then repeat the Telemedicine+Sacred 1 per kilo. Okay.
How frequently can I give that? If she responds to the mag, how frequently can I give that, Miles? As long as her pressures are okay.
If pressure's okay, I'd repeat another dose. I don't think you need to check a level, but if you needed to do a third dose, I would check a level.
How about this? Why don't we try the magnesium here? Maybe I'll recheck a blood gas in a couple hours, and we'll see where we're at. And presuming that there's no further deterioration, we could check back in telemedicine in a couple hours and decide what the best course of care is from there.
That sounds great. I'm on holiday.
Okay.
Mom, do you have any questions about anything, or?
No.
Okay.
So what we're going to do is we're going to try her on a medicine that we're going to give her an IV to see if that helps her asthma respond a little bit better. If it does not, we'll touch base with Dr. Ellen B. again. And at that point, if she's doing worse, we might have her go up to Portland to the intensive care unit where Dr. Ellen B. is now. But if she's doing better, we'll keep her here and try to keep her going close to home. Okay? Okay.
And Mom, we have a dedicated pediatric transport team that if she did need to come up, they would bring her up here. Okay, she'd be in very good hands on the way. It could be kind of scary, but. Okay. All right, so we'll check back in with you a little bit, Paul. And
okay, sounds good. Thanks for your advice, Miles. Appreciate it.
Thanks much. Bye-bye.